Mr. Perry. How you doing?
Yeah, how about you?
I'm doing well. I'm Dr. Shane. I'm the clinical pharmacist here at High Point University. It's nice to meet you.
Nice to meet you.
I just want to discuss a few things pertaining to your new Crestor medication. I'm going to start off with a few questions.
All right.
What other medications do you take along with this new Crestor?
I'm not taking any other medication besides Crestor.
Great. Tell me about your eating habits.
I like, Big Macs, fast food, Taco Bell, all the good stuff.
Do you smoke or drink? If so, how much?
So I smoke about half a pack a day and about 1 to 2 beers per night.
I want to tell you a little bit about your risk for the next 10 years of developing worsening heart disease. Your risk is 15%, and we could lower this risk by taking this medication correctly and by making some lifestyle changes. Can we talk a little bit about that?
Sure.
Thank you. After reviewing your chart, I want to point out some of your lab results. One of them being your LDL, or evil cholesterol. Our goal is to get this number below 100 to be within normal limits. Your HDL levels, or good cholesterol, is a tad low and needs a little improvement to get it above a value of 50. And lastly, your triglyceride levels. They're at 260, which is high compared to normal standards, and we would want to lower that below 150. So overall, a healthy diet goes a long way, one that involves less saturated fats and substituted with low-fat options. It is also important to try to do moderate to vigorous exercise, at least twice a week for 30 minutes or so.
Okay. It would be hard, but I'll probably do my best to eat better and to exercise more.
Good. Let's move on to your medication, shall we?
Okay.
Crestor is a great drug. You've been started on what's called a high-intensity statin, which sounds like a big deal, but it's a very safe drug to be on. It's going to stop your body from making too much cholesterol and help it use the cholesterol that it already has.
Sounds cool.
It is. Like most medicine, it's important to take this medication consistently. Pick a time in the day when it's easy to remember to take this medication. Lots of people take their medication in the morning. If that works for you, that's perfect. The key is consistency.
Yeah, I'm a morning person, so that works for me. I'll take it in the mornings.
Great. If you ever miss a dose, just take it as soon as you remember. But don't take 2 doses within 12 hours of each other.
Okay, no problem.
If you ever start to get muscle pain or fatigue, give me a call. That may be a sign that we need to try something else, and this medicine may not be the best option for you.
All right, I'll keep an eye out for that.
So before we conclude, can you tell me how you're going to take this medication so that I feel you have a grasp on this?
So from what I can understand, I will take Crestor once per day, probably mostly in the mornings, and I will try to keep an eye out for muscle pains. If that ever comes up, I'll give you a call. And if I ever miss a dose, I'll just remember to take it whenever I remember, or try not to take 2 doses within 12 hours.
You got it. You have a great day. Thanks for being here.
Oh, hi. So I was the patient in this little video we made, and I feel like Dr. Shane did a pretty good job, but he did seem to look at his paperwork more than he acknowledged me, as if it was a script or something. I don't know, but overall, he explained all the aspects of this medication and how I should be taking it. So overall, I'll give him a 8 out of 10.